Hi, my name is Shelby Bryant. I will be recording my head-to-toe assessment video. I'm in full clinical dress code. Here's my stethoscope, my pen light, and my badge. My hair is also pulled back. I will also want to apologize for any background noise. I'm at home with my two sons and my little dog. So if anything needs to be taken care of, I will exit the room and take care of it immediately. Thank you. Knock, knock. Come in. Hi, my name is Shelby Bryant. I'm a Wallace State nursing student. I'm here to do your head-to-toe assessment. Can you please verify your name and date of birth?
Braden Bosworth, January 20th, 2010.
Okay, I will now perform hand hygiene. Okay, I will now assess his posture. He is sitting upright. If you would, please walk for me from the TV back towards me so I can check your gait. His gait is normal. He does not need any assistance with walking. Aren't you? Please sit. His speech, as he just spoke, was clear. His tone was normal. I will now ask, what is your preferred language?
English.
Okay, I will now move on to vital signs. I also have cleaned all of my, cleaned them all prior to the video to save some time. His temperature is 98.1. I will now check his O2. His O2 is 99. I will now check his blood pressure. I will listen to his brachial artery with the diaphragm of my stethoscope. Hold your arm. Okay. His blood pressure was 100/60. I will now check his heart rate and respirations. I will also do this for 30 seconds, then multiply it by 2. His respirations were 12, his heart rate was 60. I will now move on to neuro to check his level of consciousness and to see if he is alert ×4. Can you please state your name for me?
Braden Bosworth.
Today's date.
April 21st,
What's the year?
2020.
And where are you?
At home
Okay. And why are you here?
because I have a headache.
Okay. He is alert and oriented ×4. I will now ask if he has any pain. Do you have any pain?
No, ma'am.
You do. You have a headache.
Ma'am.
What's wrong? we will now go, he just said that he does have a headache, so we will now go through OLCARTS. And OLCARTS is onset, location, duration, characteristics, aggravating or alleviating pain, related symptoms, treatment, and severity. Okay, so where is your head hurting at?
On the left side of my head
Okay, how long has it been hurting?
for a couple of days.
How does it feel?
Sharp?
Okay, are you taking any medicine for it?
No, ma'am.
Does anything make it worse?
No, ma'am.
Okay, and on a scale from 1 to 10, how bad is it?
A 5.
Okay, we will now move on to skin and nails. His skin is congruent through his body. He does have some minimal bruising on both legs, and they are, which is common for his age. I will now check the dorsal side of my hands for temperature. And it is also equal bilaterally. I will check his turgor. His skin goes back into place very quickly. I will now check his nails to see they are good. There is no clubbing. I will now check his capillary refill. And color returns within less than 3 seconds. I will now inspect and palpate his head. Okay, check facial symmetry. If you would, please poke out your cheeks. Smile. Make a frown face. Okay, his facial is symmetric bilaterally. I will now check his nose. His nose is patent. I will now check his mouth. Open your mouth for me. Say ah.
Ah.
Okay. His mouth is moist and pink. His tonsils are 2+. I will now check his eyes. Okay. Oh, and I will check for perla, which is pupils are equal, round, and reactive to light and accommodation. Okay, so if you would, just stare at me, please. Okay. I will also now check the 6 cranial nerves to see if cranial nerves 3, 4, and 6 are intact. Just follow my pen for me. Okay. 3, 4, and 6 are intact. I will now move on to his neck. Okay, his neck is symmetric. There is his lymph nodes are non-palpable. There is no pulsations. I could feel his carotid artery. There is no lumps in his neck. We will now check his range of motion. Okay, you could just move your hand, move your neck. From side to side, up and down. Does that hurt?
No, ma'am.
Okay. His trachea is also midline with his neck. I will now move on to listen to his heart. I will listen to the bell, listen with my stethoscope with the bell and the diaphragm. And in all 5 positions, a pet monkey. Okay, I will now listen with the bell. Okay, S1 and S2 are noted. No extra sounds were heard. I will now check for edema. And he has no edema. Okay, I will on to lungs. I will listen anterior and posterior with the diaphragm. If you could, take a deep breath for me. And again. And again. And again. Okay, I will now listen posterior. So sorry. His lungs were clear. There was no wheezing or crackles. Okay, so sorry about that. She wanted to get up on the table with my son. Okay, I will now move on to musculoskeleton. If you would, put your arms out for me. Now push against me. Okay, now your legs. Okay, now pat your hips like this. Okay, if you would, please stand up for me. Put your arms like this. We're going to test his range of motion. Now on one foot, circle. Now the other foot. Okay, was there any pain?
No, ma'am.
Okay. We will now check his sensory. Okay, if you would, please sit for me. I have two objects, sharp and soft. I will ask my patient to close his eyes. Okay, please tell me if this is sharp or soft.
Sharp. Sharp.
Okay, I'm going to test on your leg.
Sharp.
Okay.
Soft. Soft.
Okay. Okay, I will now move on to his abdomen. If you would, please lay on the table for me. All right, and I will check his contour, and I would have to get eye level to check. So if you would, please put your arms down by your side. Okay. 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 His abdomen is flat. His skin is congruent throughout. His umbilicus is midline with his abdomen. I will now listen to all vowel sounds in the right lower, right upper, and left lower of his abdomen. I will now use the bell to osculate for vascular sounds. Okay, I will now percuss and palpate. Does that hurt?
No, ma'am.
Huh?
No, ma'am. No, ma'am.
Okay, I will now palpate. Okay, does any of that hurt?
No, ma'am.
Okay, when was your last bowel movement?
This morning.
Okay, was it painful?
No, ma'am.
When did you last pee?
This morning.
Okay, was that painful?
No, ma'am.
Okay, we are now finished with the head to toe assessment. If you would, please sit up for me. I would then put his bed in the lowest position, bed rails up ×2. I would then hand him the call light and ask him if he needed anything. I would then tell him when I would be coming back, and I would do hand hygiene, and then leave the room. Thank you.